Keranova was born after a scientific discovery made by several premier laboratories in France. And we start now with a movie that explains the concept of our innovative surgical equipment.
Keranova has developed the first surgical system that will perform a photoemulsification of the human lens, becoming the new gold standard in cataract surgery by using a new generation of ultra-fast Femto laser created by its research team. The Matrix is able to perform all cataract surgery incisions and lens extraction steps from beginning to end using a single machine in the operating room. There is no required movement of the patient or added complexities to the surgeon's workflow. This brings him increased confidence, ease of use, and a saving of time and money, while providing great peace of mind and better results for the patient. A traditional surgical laser makes incisions line by moving a single focused spot in the tissue. The Matrix is much faster and more effective at making these incisions because it scans a programmable grouping of precisely spaced spots through the target surgical volume. Keranova's proprietary matrix technology uses advanced physics to modify the wavefront of the laser beam by means of a customizable phase mask. This allows the generation of multiple spots in the laser's focal plane, distributed according to a totally configurable matrix in space, in order to accelerate and improve the cutting of the tissue. The system can work up to 20 times faster than a traditional laser, with better corneal incisions and complete lens photoemulsification. The Matrix is equipped with a precision robotic arm that can operate autonomously, equipped with vision technology, advanced sensors, and programmable intelligence. This allows the system to be positioned in an extremely precise and delicate way on the eyeball of the patient under the direction of the surgeon. Keranova has developed an innovative patient interface device for docking onto the patient, which allows automatic and quick suction when touching the eyeball, using low vacuum and automatically filling the interface with BSS solution. Thanks to its new technology, full emulsification of the lens nucleus, custom capsulotomies, quality entry incisions, and corneal relaxing incisions are performed by the Matrix system at a very high speed, with high precision. The Matrix is able to achieve complete emulsification of the lens nucleus and reduce it to small enough particles to be aspirated by a simple irrigation aspiration cannula, which is integrated into the system. Once all these surgical steps are completed, Matrix releases the suction on the patient's interface device, and the robotic arm returns to its parking position. The surgeon can connect the tubing to the irrigation aspiration cannula and complete the procedure by aspiring the lens and cortex fragments and inserting the intraocular lens.
Current laser technology doesn't meet surgeons' expectations. It's time to shift to a new generation Femto laser that replaces phaco as the standard of care. A novel and all-in-one robotic system that fits into any OR and doesn't impact patient workflow. A system that makes both excellent corneal incisions and effective photoemulsification. With better accuracy, quicker surgery, and less complexity, the return on investment will be excellent. Next slide, please. Oops. Okay. The breakthrough innovation comes from advanced physics and shaping of the laser wavefront by means of a programmable phase mask. The key breakthrough is a perfect mastering of the amount of energy spread over multiple focal spots in the tissue. Next slide. The Keranova matrix technology scans much faster than current systems. It's like comparing a field plowed by an old single plow doing only one furrow at a time, to a modern farming machine producing many simultaneous furrows. Also, the number of turns around during matrix scanning is reduced, and in this example by a factor of 10, which represents a considerable reduction in procedure time. Photoemulsification requires cutting the nucleus. Next slide, please. Photoemulsification requires cutting the nucleus of the lens in approximately 20,000 cubes, each one small enough to be aspirated by a cannula without any phaco energy. The cubes are not scattered in the anterior chamber because they are covered with the anterior cortex and still in contact with each other. A preclinical regulatory trial was performed with success thanks to the first prototype system, which was used on rabbits during a standard cataract surgical procedure. Next slide. The emulsified nucleus is very well isolated from the cortex, and it forms a volume of material that separates easily from the cortex, leaving a cavity whose edges can be used to aspire the peripheral cortex. Next slide. Here is an example of what was generally observed 14 days of follow-up. There were no significant side effects, no damage on the retina or capsular bug, and most importantly, clear cornea. We have also done photoemulsification successfully on multiple cadaver eyes in Keranova labs, and we noticed beautiful images of deep fragmentation in the lens nucleus, and saw the small cubes being detached and aspired by the irrigation aspiration cannula without any phaco energy. Keranova is moving quickly and is open for discussions. Thank you for your attention.